Good morning and welcome to Radio Friends on Monday, October the 29th, just a couple of days away from Halloween, and I want to introduce you to Dr. Hemant Godara, who is with us from University Healthcare. And actually, you're fairly new to Columbia. You've been here about 3 months, right?
Correct.
Welcome to our community.
Thank you.
You are here to talk about AFib. How many people are affected by AFib?
About 5 to 6 million people currently, and the projection is by 2050 we will have about 12 million people.
Why so many more?
Because of obesity, because of our diet, more fibrosis in the atrium. Most factors that we look for are either hypertension, which is uncontrolled, diabetes, heart failure, anything that will change the structure of the heart and put more fibrosis in there. That's the current theory that causes more AFib.
So what is AFib?
Atrial fibrillation is, by definition, 30 seconds or more of irregular heart rhythm, either documented on an EKG or on some sort of electronic monitor.
Can a person tell if they're going into AFib?
Not all the time. We have had people who have been in AFib for years and have no clue.
And they don't know?
No. Some people can feel every beat. Some people have no idea. They come in with either heart failure or some other sequela, and they're found as an accident. Most often we can see during pre-op, if they're coming in for some orthopedic surgery or some other surgery, and an EKG is done as pre-op, then they can see that they're in AFib, but they have no idea.
So what do you do for it?
Most important right now that we know is symptom control. If you have symptom, which is either palpitation, shortness of breath, heart failure, we do something about it. If you don't have any symptoms, which is called silent AFib, and your ejection fraction, which is the heart pumping, is normal, then we just do rate control on top of the most important thing, stroke prevention. So we calculate a score. It's called CHADS-2-VASC score. It has 0 points to 9 points. 9 points for women, the max, and 8 points for men. The higher the points, the more chances you will have a stroke in the coming years. Unfortunately, there's no time on the CHADS-2-VASC, meaning if you are in a minute, 6 minutes, hour, 3 hours, 5 years, it doesn't matter. It is a risk assessment that we get from the CHADS-2-VASC score.
Now, if you're just going in for your regular yearly exam, and you have no symptoms whatsoever, and the doctor listens to your heart, can he tell?
Yes. So when we auscultate anybody who comes in for the physical exam, we can tell it's irregular. But then we need to get an EKG to see why it's irregular.
But you could go in for your regular exam and you not be in AFib at the time that he listens to your heart, and he wouldn't know.
Correct. And you could flip into AFib right the second you walk out of the office.
So then what do? I mean, if you have no symptoms and you go to the doctor and you're not in AFib at the time you go to the doctor, what do you do? Usually
we start looking for when people come in with vague symptoms. Could be just fatigue. Some people are very fatigued when they go into AFib, and that could be their only symptom. Sometimes, as I said, first time we see AFib is when they come in with heart failure.
Okay, but if you feel your pulse, and you've got a regular, I'm listening to feeling mine right now, and it seems like it's beating normally. What would I look for?
You would look for irregular, means instead of boom, 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 which is your regular beat, you'll be brum, 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 brum. It will be all over the place. If you have regular boom, boom, brum, boom, boom, brum, that could be something totally different.
But that doesn't mean it's serious.
Correct. So these are totally different irregular rhythms, totally different consequences.
It really is an in-depth thing, Doctor. Thank you so much for coming by.
Thank you.
If people want more information, they can call University Healthcare or check it out online, right?
Correct.
All right. Dr. Hemant Godara, I appreciate you taking your time to visit with us today.
Thank you for inviting me.
From MU Healthcare. We'll see you tomorrow. Drop me an email, pepperp@missouri.edu. Bye-bye.